I'm Emma Olatunji, and in this video, I would like to talk about gastroenteritis. Gastroenteritis, of course, let's put it this way: acute gastroenteritis. You know that acute gastroenteritis is very common around us as a bacterial infection. Some we call it food poisoning. So that's why we are looking to that today. We want to know what acute gastroenteritis is all about, causes, clinical features, and how we can manage it at home, and how we can manage it in the hospital. So having said that, acute gastroenteritis is the inflammation of stomach, intestine, bowel, secondary to an infectious agent, often injected via contaminated food and drink. I repeat myself, I call it again. So I said acute gastroenteritis is the inflammation of the stomach, intestine, bowel, secondary to an infectious agent, often injected via contaminated food and drink. So bouncing away from that now, what are now the causes of acute gastroenteritis? Causes of acute gastroenteritis. Well, it is caused by food and drink contaminated with bacteria such as Clostridium, botulinum, which can be found in honey, salmonella species, which can be found in eggs, milk, Entamoeba histolytica, which can be found in juice, Escherichia coli, which can be found in beef, Vibrio parahaemolyticus, which can be found in fish, Bacillus cerus, which can be found in the reheated rice, Listeria species, which can be found in the cheese, and of course Clostridium perfringes, which can be found in the canned food, and so on like that. So moving away from that now, let's now quickly look into clinical features of gastroenteritis. So clinical features of gastroenteritis may include nausea and vomiting, headache, low-grade fever, anorexia, crampy abdominal pain, passage of watery stool, abdominal tenderness and spasm, general body weakness, hypothermia, rapid low pulse, hypothermia, hypotension, decreased skin tone, and so on like that. So now let's now quickly look into management of acute gastroenteritis. How we can manage it at home and how we can manage it in the hospital is very simple. So now let's quickly look into pre-hospital management. That is how we can manage it at home first. Of course, the first thing to do at home is to place your patient in a comfortable position. You reassure patient and his or her relative. You assess airway breathing circulation interval when necessary, and of course, if you can check the vital signs, it will be very good. If you can check vital signs, you check and monitor vital signs, and of course, you restrict oral intake, to avoid further vomiting, and you also restrict unnecessary movement of patients to decrease peristaltic and metabolic rate, as well as to conserve energy, and of course diversional provision of diversional activities is also helpful, to for reducing pain. You provide diversional therapy or diversional activities, very helpful for reducing pain, and local application of warm compress, to control hypothermia and as well as to reduce pain, and you transfer patient to the appropriate hospital. Now let's now quickly look into hospital-based management of acute gastroenteritis. Of course, the first thing to do in the hospital: reception and admission of patient. Place patient in a comfortable position. You reassure patients and his or her relative. You check and document vital signs. You assess airway breathing circulation and intervene when necessary. If cardiac monitor is available, connect patient to cardiac monitor. And of course, you assist doctor to secure IV access and to obtain blood sample for laboratory investigations such as full blood count, electrolyte, and so on and so on, like that. And you encourage you administer prescribed IV fluid and medication. You monitor fluid intake and output, and you encourage bed rest, to reduce or to decrease peristalsis and metabolic rate, to decrease the metabolic rate, and the provision of ready access to toilet, bedpan. Of course, you keep your environment clean and odor free. And after treatment is initiated, you keep record of frequency and consistency of stools. And as soon as oral foods are tolerated, you encourage patients to take a small frequent high protein food. You encourage patients to take small frequent high protein food, but to reduce low fat and residual food. And lastly, you encourage patients on personal and food hygiene. You encourage patients on personal and food hygiene. That's all about acute gastroenteritis. It's very, very simple. It's something you can do at home. All you have to do is just to place your patient in a comfortable position. You restrict oral intake, to avoid further vomiting. You can administer the oral rehydration therapy that we call ORS, or oral rehydration solution. You administer, and you provide interventional therapy for patients, and you restrict unnecessary movement, and you can apply the local warm compress to control hypothermia and to reduce pain. So acute gastroenteritis is an inflammation of, or is the inflammation of stomach, intestine, bowel, secondary to an infectious agent, often injected by contaminated food and or via contaminated food and drink, and they are caused by bacteria such as Clostridium, botulinum, salmonella species, Entamoeba, histolytica, Vibrio, parahaemolyticus, Listeria species, Clostridium perfringes, and so on and so on, like that. So on this note, I would like to call it a day, and please subscribe to my YouTube channel, Packaging 14. So till I come your way next, always remember, health is wealth. Stay safe, stay healthy, and I say remain blessed. Thank you.